Says bird's nest here.
That could be fun.
Y'all are definitely not social distancing.
I know.
Are you bothered?
I don't either.
That's not like teasing her.
Yes, sir. So are we ready to start?
We'll put it up.
Let's see, somebody needs to get the scroll.
I think Sam's just saying we're gonna need it for your interview. Whatever the other one is.
We've got one round.
What happened to ones that went over to Abbott for the day? Where did they get the one came back?
Bring them back.
How do,
I think they're still on.
Yes, we can hear you. Yes, yeah.
okay, well, good morning, and thank you for joining us today. We're doing something a little different today, and you may be getting a little reverb. Hopefully, we'll get this working properly for you here just shortly. Know that we're grateful that our community remains safe in yesterday's storms, and we send out our thoughts to those who were impacted across the Southeast. I want to remind you that this week is National Public Safety Telecommunicators Week. Thank you to the Morgan County 911 system and our dispatchers for all that you do. Now I want to take a few minutes to introduce today's guest. We're happy to have back Decatur Morgan Hospital Chief Nursing Officer Anita Walden. Anita will give us the latest information on how our hospital system is responding and treating COVID-19 cases. We're so thankful for the service of our healthcare providers, especially during this time. And then we're joined from Montgomery via WebEx, Alabama League of Municipalities Deputy Director Gregg Cochran, and Press Affairs Associate Kaylee Bass, as well as Chief Counsel Lori Lyon. And the League of Municipalities provides a valuable service to over 465 local municipalities across the state. And we're honored to have the representatives joining us virtually today. And then, of course, we have with us Kelly Halbrooks, who is, again, assisting us with sign language, and we're so thankful for Kelly. Now, this morning we woke up with confirmed cases in our county. I believe at 41. Is that?
I think that's correct.
Correct. Now at 41, but the 345 tested, and that number continues to hold level for a couple of days.
It does.
Yeah, that's very positive. Our efforts and adherence to the health orders we've received, they're paying off. And again, we just want to encourage our residents to not become complacent. Keep that full court press on. A reminder that playgrounds and public athletic courts are temporarily closed. Remember, while we can't get out, it's still important to call and check on our elderly neighbors to make sure that they're okay. If you have any questions, you can always reach out to your council representatives or me. Our information is available on our website at DecaturAlabamaUSA.com. That's Decatur, Alabama, USA.com. Receiving some really encouraging emails and messages from our local restaurants about how you're really doing a great job in supporting them by ordering curbside, takeout, or enjoying delivery, and that you're buying gift cards. So continue to support our local businesses. A reminder that City Hall will still be open, but by appointment only, with the exception of the Decatur Police Department. A reminder that whenever you call City Hall, oftentimes that we are able to take care of your business over the phone. So please don't hesitate to reach out to us. Garbage service will continue to operate as normal. And just a reminder that our curbside recycling is temporarily suspended. So with that, that's what I have to share. And now I will turn this over to Miss Anita. Thank you.
Okay. Good morning. Thank you again to everyone who has stepped up to make this unprecedented time of uncertainty and inconvenience also a time of unity and an outpouring of generosity. There are so many good stories that we have heard, that we have seen, of how people have gone out of their way to be helpful and kind. We see people taking care of each other. And so we know that there are people that are delivering meals and groceries to those who cannot and should not be out of their homes, offering to pick up their prescriptions and those kinds of things. We at the hospital have been so thankful and so humbled by the tremendous and continuous offers of support to us. We have had food, and more food. We may need some help with a Weight Watcher subscription after all this is over. We've had donations of masks of all kinds, both N95s of several versions and homemade masks, such as this one. We've had parades. We've had words of encouragement. We've had sidewalk chalk messages. We've had lawn signs and posters. We've had Facebook messages, shares and memes. Other ways that you can help, if you still want to help, and we hope you do, are we still need homemade masks. Those are very useful for our team members. Also, you can still make financial gifts to the foundation. Go to the Decatur Morgan web page and scroll to the bottom, and there's a place for donations. Speaking of Facebook, there was a wonderful success story about one of our very first patients who tested positive for coronavirus. This young gentleman posted his incredible story of survival to his Facebook page, and it has been shared many times. So hopefully some of you can read that. We are so proud of him and so grateful for that outcome. I've had several people ask, what is the difference in coronavirus and COVID-19? So coronavirus is actually refers to a handful of diseases. Think of trying to describe a pit bull as a dog. It's a vast difference. The severity of coronaviruses can range from being mild, like a common cold, to more serious symptoms that can lead to hospitalization, like lung problems. COVID-19 is what experts are calling this particular disease that we're going through right now. It's a new type of coronavirus. It was not previously known or understood by health experts. It can lead to major health problems such as pneumonia and organ failure, and it can cause issues like shortness of breath and fever, which is what we're seeing. This is a very simplistic explanation. So if you want more information, please Google it. There's a lot of information out there. Make sure that you go to a trusted site, however. The numbers for COVID-19 at our hospital. We have tested 170 patients thereabout. That was as of early this morning. We have 116 of those collections in our emergency department. We have tested 46 in the inpatient setting, and 8 of those were in our outpatient collections, such as people that came in specifically to the hospital to be tested. We have had 6 positive results in the hospital and 2 positives that were tested elsewhere before they were admitted to the hospital. So 8 total that were hospitalized. In our community testing at our drive-through clinic, since we opened a couple of weeks ago, we've tested 142 people in the community. 133 of those have been negative. We've had 3 positives and we have 6 pending, and that was over the weekend, so I'm sure we have those results today. Our patient volume at the hospital. With the outbreak of the coronavirus, our elective surgery procedures have been postponed. The only ones that we are really doing are those that are emergent, people that may have cancer. We wouldn't want them to delay. So we're being very careful about what surgeries we are taking. Some of our outpatient testing in departments like imaging, x-ray, our CTs, cath labs, sleep studies, and our lab have also been heavily impacted. All hospitals in the Huntsville hospital system are experiencing incredibly low volumes in our EDs, our inpatient, and our outpatient testing areas. EDs at the Decatur campus and our Parkway campus have experienced at least a 40% drop, some greater than that. So unless there's a dire need, people are simply staying at home. Inpatients has seen about a 20% drop, maybe more than that sometimes, and that is simply because of elective surgeries have been eliminated. We can, I've talked to you before about people with chronic illnesses. I continue to worry about that. Please, if you have a chronic illness and you're at home, you're afraid to come out, don't wait too late. Make sure that you're getting the care that you need, the medications that you need, and if you need to come to the hospital, please do not hesitate to do that. Department closings and reductions. I know that people have heard a lot about that. I saw a lot about it on Facebook this weekend, some true, some not true. Understand that we routinely flex people off when census is low. This is no different. Many employees have been flexed off from their normal job duties and departments in various ways. Some have been reassigned to other responsibilities, such as taking temperatures, cleaning every surface, sent to other departments that may need help. Our ICUs are very busy, as you might guess, our step-down unit. Some have been temporarily furloughed. Now, what does that mean? That's different from just taking vacation time, which some people have opted to do. They're taking a vacation. Their kids are out of school and they're taking this opportunity to stay home with their kids. But for those who were furloughed, what that means is they are able to keep their hospital benefits. They can file for unemployment benefits related to the COVID-19 pandemic. The Alabama Department of Labor announced that Alabama's standard unemployment payments have been increased by $600 per week due to the Federal CARES Act. So that is great news for our team members that had to be furloughed. When this is passed, we hope to bring them back to their full employment in the future. That is our plan. Even though our patient volumes are decreased, there's still sick patients that need our care, and we're doing our very best to give them the care that they need, no matter what the circumstances. We need your help in protecting our staff and you from possible exposures to the coronavirus. Although we do all we can by giving our team members the tools and the supplies that they need in PPE or personal protective equipment, there's still things that you can do to help us. Our ED patients are greeted outside the emergency department for a real quick triage. And these are done by gowned, masked, and gloved people. If a patient exhibits respiratory symptoms or fever related to a possible COVID-19 diagnosis, we want to know before you enter our building so that we can take the necessary precautions. One of the precautions is a mask for the patient. So if the symptoms are present, you will have a mask on. You'll be immediately taken to a designated respiratory room in the emergency department. And then everyone who enters your room will be gowned and masked and gloved appropriately. If you're coming to the hospital just to have a chest x-ray or a CT or lab drawn, just as a precaution, when you come at the registration area, you will be given a mask to wear. Now, if you have your own mask, that's great. That saves PPE at the hospital. But if you don't, we will provide a mask for you. If you've been tested for COVID-19 prior to coming to the hospital, whether you're coming to the ED, you're coming as an outpatient for testing, or you're coming to be admitted as a patient, please notify us. Let us know if you have previously been tested for COVID-19, because we would love to know what that result was, but if you don't have your result yet, we need to take necessary precautions for you and for our team members. I brought a mask. I'll take just 1 second. A homemade mask such as this works very well. If you are out and about, or if you're at the hospital, when you're placing that mask on, be very careful that you do not touch the area that's going to touch your mouth or your nose. So you put it on such as this. When you take it off, you want to carefully take it off by the handles or the ties. Never put your fingers or your thumbs inside the mask. And then you can carefully close it and place it in a plastic bag. That is to protect you from getting germs from your hands or anything inside your mask. That was just an extra. Thank you so much.
Thank you, Anita, for the detailed update. We really appreciate that. And
Absolutely.
of course, we'll take some questions here
Okay.
shortly. So now we want to reach out to our friends with the Alabama League of Municipalities from their Montgomery headquarters. We have with us Gregg Cochran here on the call, the screen. Gregg, can you hear me? Good morning. Give us a hello, Gregg.
Can you hear me, Mayor?
Yes, we can. Now we can.
Okay,
Great.
I apologize. All right. Thank you. We want to thank the mayor for hosting this webinar and town hall meeting. It's great leadership on his behalf. He's been active in our association, active with the Big Ten mayors. He's constantly been energized and engaged on talking to the governor of the public health department, our congressional delegation on behalf of the citizens to ensure that the message that cities need frontline help to get through this is on their minds, and we appreciate his engagement and leadership. As an association, we are working diligently with the congressional delegation to ensure that as they consider stimulus packages, that there are monies there available for our cities. Our cities rely on sales and use taxes, motor fuel taxes, lodgings, rentals, and occupational taxes in some areas of the state to fulfill the essential needs that their citizens desire. Making sure that Congress is aware of the lost revenue streams that we're experiencing as we go into the summer is important and vital to the health of our cities, and to ensure that we can continue to have these services available to our citizens as we recover and rebuild from this economic loss. We are also working with our legislative delegation. Our governor, legislative leaders have worked with us on our behalf to write Congress, to write the president, to ensure that there are monies available for our cities. The CARES Act, which sends $1.9 billion to the state of Alabama, will certainly help our state and help our hospitals and other healthcare organizations, but that money is earmarked for expenditures towards the COVID-19 disease. That does not help us with the lost revenues that we are going to be experiencing. Mayor, I want to thank you again for having this conference call. Thank you for including us, and we'll be glad to take any questions that may arise.
So Gregg, your website provides some information, a lot of links that might be helpful for those that are viewing this.
We do. We have a resource page at alalm.org. COVID-19, it's the very first site that you run to on our opening page, has multiple resources there from the governor, from the public health department, from local municipalities that have adopted stay-in-place orders, and others. Mayor, at this time also, I would expand that conversation to say that we have formed a 10-member task force of municipal officials from across our state to study and collect the losses that we are seeing, the devastating effect this is having on our economies locally, and how we can be of help in securing funding and other services to those cities as we move forward towards a rebuilding period from this event.
Thank you, Gregg. That's very helpful, and I hope that our residents will take the opportunity to visit alm.org. That's A as in Alabama, L for league, M for municipalities. Thank you again for joining us. And now I'm seeing that we don't have any questions from the media. I do want to present a couple myself while we're still together. We learned Anita late Friday, that the president and CEO of Decatur Morgan Hospital, Nat Richardson, has received a very nice opportunity in Maryland to head up a system there. Nat has been a wonderful leader, a wonderful asset to our community, and he and Donna are they will be sorely missed. I think we saw over $50 million in improvements to the Decatur Morgan Hospital under Nat's leadership. But any comments, any thoughts from you? I know that y'all work very closely together. Not to put you on the
We
spot.
do. No, it's fine. Yeah, I've tried to be.
If you heard anything about wrong.
I've tried to be mad at him a little bit, but Nat is a great guy, and we are going to sorely miss him. We're happy that he has been presented an offer, and like I said, we're going to miss him, but he has been wonderful in his leadership. He has delegated to the administrative team diligently through his 8 years working with us, and so we work hard, and we're going to continue to work hard. We've got a strong, great team, and so we're going to have him on speed dial. So
Very good. Thank you.
Absolutely.
So, Gregg, coming back to the league, there's a group of professionals, a lot of folks. We give a lot of attention and well deserved to our healthcare workers, but our bankers are working overtime right now, trying to get loans processed to help Alabama businesses. And it seems like there's not a lot said about the work that our bankers are doing so that they can bring this help. Do you hear much from the league and mayors across the state about that?
Mayor, I'm sorry that we've had a disturbance in the connection, and I'm only getting about every third words that you're communicating through this WebEx. Would you like us to call in on the conference call and continue that way?
Well, did you hear me talk about the work that our bankers are doing?
No, sir, I couldn't. We had a power surge here, and since it came back on, I'm only getting about one of every third word.
Okay. Well, look, what we're going to do is
Kayla is logging in on the conference call part, and that way I can answer your questions. You'll give us just a second to connect, and then I'd ask you to be.
No, I don't hear it.
Okay, so the question that, can you hear me?
Hello?
Hey, Kayla, can you hear me?
Hey.
Hey, so what I was,
Yeah.
okay,
Yeah.
so what I was talking about, we're so thankful for it. So many are working together to help get us through this this crisis, this COVID-19 event. A lot of attention is, and rightfully so, has been given to our healthcare workers, our first responders, but we have our bankers who are working day and night, weekends, processing loans for our business community. Is the league hearing much from municipalities across the state about that effort?
Mayor, again, I'm still having trouble understanding, but I think you're asking about the small business loan opportunity that's in the CARES Act, and our municipalities experiencing difficulty in their local businesses being able to connect to those banks and to those services. And I believe that is truthful. There are pockets where the banks have had success in getting through to that program, but my understanding is a large part of the state has had difficulty technically getting into the SBA website and getting into that program where they can load those loan applications to ensure that they have federal backing.
Thank you, Greg. And Decatur's very thankful
Yes,
that
sir.
we have been successful in getting those, many of those loan requests processed. So with that, thank you so much for joining us today. We will return Wednesday, April the 15th at 10 o'clock. Thank you.
Thank you, Mayor.